Let's face it, we know as well as anyone that speaking the health insurance language can be tough to understand, especially if you're just starting out. But that's why we're here. It's so important to get through the basics first. A little bit of knowledge about the terms in the beginning will go a long way towards helping you make sense of it all in the end. So let's dig in. The first term we're going to talk about is copayment, or copay for short. A copay is a fixed, out-of-pocket amount paid by the patient for covered medical expenses at the time they receive the service. It is a specified dollar amount. Copays can vary for different services within the patient's plan, meaning a copay can be different for an office visit, a specialist visit, a hospital visit, lab tests, pharmacy, or any other kind of visit. In addition, there are some services that require a copay and then some that do not. For example, if a patient comes in and you're billing an office visit and, say, a visual field, the copay will likely be applied to the office visit and not the visual field. Usually, the service that is not subject to copay will just be subject to deductible or coinsurance. A copay is collected per date of service rather than per service. So you wouldn't bill a copay for each line that you're billing on. You would just bill one copay for one date of service. Our next term is deductible. A deductible is a specific dollar amount a patient will pay out of pocket toward covered medical care each year before the insurance plan starts to pay for services. So, if a patient has a $1,000 deductible, this is how much they're going to have to pay out of their pocket before insurance will start paying anything on their behalf. Most plans do not count copays towards a deductible. Our next term is coinsurance. Coinsurance is a cost-sharing requirement similar to copays and deductibles, but is usually a percentage rather than a fixed amount. It is completely separate from copays and deductibles and is something that a patient will pay once their deductible has been met, in addition to their copay if there is one. The patient will pay their $20 copay at the time of service and you will submit the claim to insurance. So let's look at an example. A patient comes into your practice and they have a $20 copay, and let's say you bill a $100 service fee. They will pay their $20 copay and you will submit the claim to insurance. If the deductible is not met, the insurance will kick back the allowed amount for that service fee to the patient for the patient to pay directly to the practice. If the deductible is met, then that is when coinsurance comes into play and the patient will pay 20% of that allowed amount for that service charge. What is an allowable or allowed amount, you ask? Well, an allowable is a dollar amount considered payment in full by an insurance company for a specific service charge. It is a total amount that a provider will be paid for a service from both the patient and insurance. The allowable is typically a discounted rate rather than the full amount that the provider charges for that service. Let's look at another example. A provider may charge $100 for a service, but the insurance company may only allow $70 for that service charge fee. Therefore, insurance pays that $70 rather than $100 that you billed them. Most of the time, a copay is considered in that allowable amount. So, if the full service fee is $100, the allowable is $70, and the copay is $20, the patient will pay the $20 copay, and insurance will pay the remaining $50 of the allowable. These allowable fees can vary from different insurances and can change from year to year. Our next term is out-of-pocket. Health insurance plans have out-of-pocket maximums. These are caps on the amount of money that an insured person will spend each year on covered healthcare expenses. These expenses are costs that the patient will pay out of their own pocket, just like it sounds. Examples of out-of-pocket are copays, deductibles, and coinsurance. So let's take the same example from before, but let's take copay out of it so it's a little easier to understand. A patient comes in for a visit and you charge a $100 service fee to insurance. The insurance allows $70 for that service charge, and we will assume that the patient has a 20% coinsurance. If deductible is not met, insurance will kick back that $70 allowable to the patient to pay towards deductible. This will also count towards the patient's out-of-pocket. If the deductible is met, the insurance will kick back $14, which is 20% of that $70 allowable, to the patient to pay towards coinsurance. Like the deductible, this will also count towards the patient's out-of-pocket. If the deductible and out-of-pocket are met, the office will not collect anything from the patient at all and submit the claim to insurance. Once insurance successfully processes the claim, they will pay the full $70 allowable to the provider. Now, let's go through a big picture example so we can put it all together. This sample insurance plan has a $20 copay, a $1,000 annual deductible, a 20% coinsurance after deductible, and a $6,000 out-of-pocket maximum. So say your insurance plan has just started. You have paid nothing toward deductible or out-of-pocket yet. If you have a medical visit that costs $10,000, you would pay your $20 copay at the visit. Next, you would be responsible to pay the deductible, $1,000. Remember, copays do not typically count towards a deductible, so now there is a remaining $9,000 from that visit, and you will take coinsurance into account. The coinsurance for this plan is 20%, so 20% of the remaining $9,000 bill would be $1,800 that will be owed to the provider. Now you have paid a total of $2,820 out of pocket. This amount applies to the $6,000 out-of-pocket maximum, meaning now there is only $3,180 left to pay out of your pocket before insurance will pay for your medical visits in full. Once the $6,000 out-of-pocket has been met, you will not have to pay anything towards copay, coinsurance, or deductible for the rest of the plan year. One thing to remember is that all medical care considers copays, deductibles, and coinsurance into account. So your office is not the only one billing these patients for these services, right? For instance, with Medicare, these patients typically have a very low deductible that starts over every calendar year, so they usually meet it pretty quickly. Other private insurances may have a larger deductible, and so it's likely that patients may not meet their out-of-pocket or deductible for that plan. In some instances, that patient may have had a catastrophic event that caused them to meet their deductible and out-of-pocket very early, so always check. Clear as mud? Don't worry. Once we get further into the course, everything will come together and make sense. For now, let's get through a few more terms that you will hear throughout our course. The next term is allowance, which sounds an awful lot like an allowable, right? Wrong. It's different. In our industry, an allowance is a set amount of money that the insurance plan covers toward the purchase of materials, which are frames, lenses, and/or contact lenses. An allowance is different from an allowable because it's specifically used towards materials rather than an exam service charge fee. We'll dive more into allowance later in the course when we're talking about billing. Our next term is in-network. Being in-network refers to healthcare providers that are contracted with a specific insurance company to accept negotiated rates, aka allowables. Patients will typically pay less when seeing a provider who is in-network with their insurance company. The next term is out-of-network, which is the exact opposite of in-network. It means that the provider the individual sees does not have a contract with that health insurance company. Patients will typically pay more out-of-pocket when seeing an out-of-network provider. Our last term is National Provider Identifier, or NPI for short.
Wishing you a
NPI
very
is a
happy
unique
birthday.
10-digit identification number assigned to healthcare providers. All healthcare providers are required to apply for an NPI if they want to submit claims to insurance. There are two types. A Type 1 NPI is a provider's individual NPI number. A Type 2 NPI is an NPI for a healthcare organization or a group practice, where there are multiple providers. The purpose of the two NPIs can be explained better if you think of a patient who is being seen in a large group practice. The insurance wants to know which particular group saw that patient, which is the Type 2 NPI, and they also want to know which actual doctor saw the patient, which is the Type 1 NPI. To successfully process the claim, insurance will need both NPIs on the claim to do so. We'll get more into NPIs later when we talk about claims and submitting those, but for now, we're going to move on to our next section, effectively credential your doctors.